Hello, my name is Stacey Grothuse. I am going to talk to you today a little bit about the importance of cardiac rehabilitation and the purpose of my capstone project. So the objectives for this PowerPoint are to understand the importance of cardiac rehabilitation and the benefits that provides the patient, realize that low enrollment rates are directly related to low referral rates, understand the appropriate diagnoses and referral process into cardiac rehab, and understand how to use the toolkit and the benefits that it might provide the patient with the resources that I will show you at the end of the presentation. Just a quick recap, I know most of us know that heart disease is the leading cause of death in the world. However, when somebody has a cardiac event, a second cardiac event is very likely after the first without any kind of intervention. And cardiac rehabilitation has been proven to reduce not only cardiac, but overall mortality. The cardiac rehab participants have shown to improve in recurrent angina, total exercise time, ST segment decline, angina, and maximum exercise tolerance than non-participants. The problem with this is the cardiac enrollment is really as little as 10 to 34% of eligible patients. So the purpose of the capstone is to look at evidence and put that into practice. So the AHRQ recommendation statement as of 2019 is putting together a 3-year project to specifically increase cardiac rehab participation, something worth $6 million, and their goal is to increase from 20% to 70%. And they're saying that doing this could save 25,000 lives and 180,000 hospitalizations every year. So the CDC has also put out a change package, which manages 4 different areas of why enrollment and participation of cardiac rehab are so low. Basically, this presentation and my whole capstone is to parallel the national initiatives and bring it to an outpatient level. So we're seeing a lot of these initiatives go into the inpatient. And what I'm saying is let's also have a push to get more referrals and things in outpatient so the patients who are discharged from the hospital don't get missed. So a little bit about what cardiac rehab is. It is a medically supervised exercise program, but it's much more than just the exercise. The patients do get an individual and progressive exercise counseling and monitoring. So when the patient gets enrolled into cardiac rehab, they'll have an initial assessment with an RN who will, again, individualize a program for that patient. And throughout the process, they'll also be receiving education on risk factor modification, medications, and a variety of other topics, as well as emotional support. There are 3 phases to cardiac rehab. So phase 1 is what we're seeing when they're in the hospital. So right after a surgery or something like that, cardiac rehab members will actually go see the patient, try and get them up out of bed, get them walking, and give them a little bit of education to get them into the phase 2. So this phase 2 is really what I am targeting for us. So the phase 2 patients start after their hospitalization to go to an outpatient exercise program where they are monitored. So the phase 2 should start about 4 to 6 weeks after their discharge. It is initiated by a referral or an order. The patients are set up to go 2 to 3 times a week for a total of 18 to 36 sessions where they are completely monitored. So they are wearing telemetry, their heart rate and rhythm is monitored, blood pressure, oxygen saturation, all that good stuff the entire time that they're there. They also receive weekly education, again, about risk factors and things like that from the team members of the cardiac rehab. And the physicians also get a monthly treatment progress plan for that patient. So even you as a doctor and a doctor's office can know how your patient is progressing. It is covered by most insurances, and basically the end goal is really to help the patients develop long-term exercise goals, dietary modification, and all kinds of healthy lifestyle changes that really improve their overall cardiovascular health. So again, as I've said, there are many, many benefits to cardiac rehab, reducing a ton of symptoms, cardiac symptoms, improving their adherence to medications, which is really important too. Again, the team members are very involved with the patients when they get into cardiac rehab. So they will review their medications, they talk about compliance, and they can also report back to you if maybe a patient isn't taking their medication correctly. We see improvements of blood pressure, lipid, blood sugar levels, weight loss, of course, the ability to return to work even sooner, improvement of psychosocial issues, and improved collateral circulation, endothelial function, and increased supply of oxygen to the cardiac muscle. So these are the 2 flagship hospitals, Orlando Health and one is Advent Health, that have the largest cardiac rehabs. If we just get in touch with these main ones, they can direct the patient to one that's more convenient if they would like a different location. So the eligibility for referral, this is based off CMS guidelines. Am I within the last 12 months, PTCA with or without stenting, heart failure, cabbage and bowel surgery, stable angina, and a post-heart transplant? How to refer, orders can actually be placed directly into Sunrise for Orlando Health and then also Allscript. Or you can complete a referral form, which I've provided in the toolkit that you can send to the hospital of their choice. And even if you are unsure if the patient is eligible or if the patient's not sure that they're interested, it's better to just go ahead and refer. The cardiac rehab team will check their insurance and make sure that they don't have a copay or whatever it may be. And if they do, they will make the patient aware before they get them started. So the toolkit is what I wanted to show you here. So this is going to be available in your office. That was created just for your office and for your patients. So this toolkit starts out with a table of contents so you can find what you need based on numbered labels and tabs. So number 1 is this PowerPoint presentation, just for your reference if you needed a reminder. Number 2 is the referral form that I was talking about. This was created specifically for your office. So it allows the physician to just check mark the diagnosis of the patient. It even has some standing orders that are typical for cardiac rehab. So this is something that can just be signed and given to the patient. Number 3, these are called badge buddies. I'm sure you're familiar or have something like it, but it is handy if you wanted to attach it to your medical badge. And it has the qualifying diagnoses for cardiac rehab on there for quick reference, as well as the fax numbers for both the Orlando Health and the Advent Health major cardiac rehab facilities. Number 4 is some promotional posters. These can be hung up in the office. It might prompt the patients to ask about cardiac rehab. So there are 2 versions of that. The next one is brochures for the patient. So this has all kinds of information about what cardiac rehab is that is very simplified for the patient. So excellent information for them if it's something that you're going to refer them for if they have questions. So in English, and then there's one in Spanish. The next one is AACVPR fact sheet on cardiac rehab. Again, just a really great resource for the patient if you wanted to hand it out to them for if they have questions or hang it up in the office. Number 7 is going to be logs. This is a good way to get your patient starting, maybe thinking about cardiac rehab. There is an activity log, angina log, blood pressure log, and then a medication log in English and in Spanish. And again, these are very helpful resources if they started to do them before they come into cardiac rehab. We can use those for sure. Number 8, this is going to be a miniature version of the education that they'll receive in cardiac rehab just to get them started. So again, it kind of helps make them interested in some of the things they'll be learning. So this little mini packet can be handed to the patient and they can start on the education that they'll learn once they get into cardiac rehab. It has stuff about the heart structure, risk factors, angina, stress, and exercise. So again, just a really nice, handy little educational packet that you can give to the patient. Since this one is a larger packet, the master copy is in the back. All the resources in the kit have a master copy, so the last page will have a highlighter, master copy, so that it doesn't get used, and it can be copied and make more to fill back into the book if the last one were to be used. And then the last section is American Heart Association fact sheets. So there's all kinds of diagnoses here. Again, just very handy to give to the patient to give them more education. So the first one will be in English and the one behind it will be in Spanish. And there's all kinds of diagnoses here, quit smoking, diet, exercise, things like that back here. So again, this is the toolkit that will be available to your office. The point of this capstone is really to see if this tool will work in hopes that it helps both you and the patient, that we can possibly increase referral rates into cardiac rehab. So I will be looking forward to talking to you again in 3 months to see which resources in here you liked best and which ones you used the most. I thank you again for your participation and your time, and I really hope this helps you and your patients. Thank you.